Hi everybody, Jeremy here, Modern Vitality. In today's video, we're looking at our tongues, tongue diagnosis. Why are we looking at our tongues? Why is this important? Well, if you have one of these complex chronic conditions like fibromyalgia, chronic fatigue syndrome, long haulers, chronic Lyme, adrenal fatigue, Epstein-Barr virus that's reactivated, candida, mold illness, EMF sensitivity, MCAS, there's a ton of these things. They're on the rise. All these complicated autoimmune type illnesses are like, it's insane how many people are getting affected by this. And it's very, very baffling for most doctors, conventional and alternative, because they are so complex and multifaceted. And one of the things I've noticed and observed over my career here is that a lot of the patients who have these conditions wind up knowing more about the condition than most doctors do. And you wind up having to take a lot of things into your own hands, which is great. That's why I'm here, to help you empower yourself, right, with information. And one of the things that is really, really helpful for a lot of the people I work with is to be able to look at their tongue and understand what it's trying to tell them. We can learn a lot from the appearance of your tongue. I'm going to go over all these parameters. I'm going to show you how to do this so that you can wake up in the morning, look in the mirror, and basically have a diagnostic indicator of what your body is asking for and what it needs. This is phenomenal stuff. I've got a very strong background in Eastern medicine, which is where we look at tongues. For the most part, it's like acupuncturists and herbalists that are doing tongue diagnosis. However, what's really cool here is that a lot of the traditional things about the tongue that you're taught as a Chinese medicine practitioner, for example, it turns out nowadays we have science coming up to actually verify and validate the things that we knew. So I'm going to be breaking all that down in this video so that you can use this information to start to diagnose yourself. And we're going to be going over Tongue 101. All right, let's get started. So the first thing we need to do is talk about some of the logistics. When you're going to look at your tongue, the best thing to do is to obviously not have just had a big cup of coffee or like a super green smoothie or something, because you're going to stick your tongue out and you're going to see all this stained up mess. That's false data. Okay, so when you're looking at your tongue, one of the best times is in the morning before you've put anything in your mouth. And the other thing I'll say too, some people scrape their tongues. They have these tongue scrapers, right? They're usually copper or something. That's fine. You can scrape your tongue, you can clean your tongue. However, I would recommend that you look at it beforehand, because again, if you scrape away all the biofilm and all the gunk, that's fine for trying to improve your hygiene of your oral microbiome. That's totally fine. But we also do want to see kind of the messy stuff so that we can see what your body is trying to say. So those are the two kind of logistics. Don't eat a bunch of stuff to get a false reading, and then also don't clean it up and then look at it, because that's not going to give you good information either. So when we're looking at the tongue, you want to just pop your tongue out and you want to have it be like relaxed. So don't stick it. You're not trying to stick it straight out. You shouldn't be working too hard. Just let it flop out of your mouth and take a look. And one of the things we're going to look at, there are some different parameters here. They're very important. One of the things we're going to look at is the body of the tongue. Okay, the actual meat of the tongue. And people have asked me in my career, why are you looking at tongues? What is this about? Well, one of the things that I think is really worth mentioning is that your tongue is a muscle. Okay, that's why I can use it to speak. And when we talk, it moves around. I can eat and it moves. I can clean my own teeth. You can stick it out. You can do all these things because it's a muscle. And just like every other muscle, it requires blood circulation, right? The really cool thing about the tongue is that it's a muscle that doesn't have skin over top of it. So if we want to get a sense of the general circulation of all the tissue in your body, all the muscles, we don't have to cut you open and look at them. Right? Instead, we can just look at the muscle that's exposed, which is the tongue. It naturally doesn't have all this skin in the way. So you want to look at the tongue body, and you want to look for the color, right, of the tongue body, because that will tell you a lot about your blood circulation. So if you have a very pale looking tongue, then most likely, not always, and I'm not your doctor diagnosing this stuff, right? This channel isn't medical advice. This is information for responsible adults that want to take their health into their own hands, okay? But if you look at your tongue and it's pretty pale, chances are you're running on the anemic side, right? There's some kind of lack of blood coming in, which is why the tissue is pale. Same thing if it starts to go like bluish, that's a big problem, right? But pale, you want to shoot for kind of a pink tongue, like a healthy pink. Should be just pink looking. And there are tons of pictures. You can do your own research here and you can start to see what a lot of tongues look like. You can go online and look up, tongues and all that. This video will get you started with a hefty framework for that kind of analysis, but you want to get kind of a pink color. Now, besides pink, it could also be really red. Now, red is a sign of inflammation for us. We're seeing that there's a lot of heat. In Eastern medicine, it's like the heat, right? The redness shows heat, but we're also looking at inflammation. And then another color that's of concern would be purple. So if you see purple, that means there's a lot of stasis. That means there's a lot of blood that's kind of stuck in the tissues that's not moving out. So already, just by looking at the meat of the tongue, right, that tongue body, they call it the meat, right, that flops out, you can look at it. And just by checking the color, you can start to get a sense of the circulation, the blood circulation. And this is going to be indicative of the rest of your body, right, because it's one muscle of many. And there are these ideas, right, where you have the macrocosm and the microcosm, meaning you look at one small part and it reflects the whole. And the tongue is one way to do that because you're looking at blood circulation in a muscle tissue. So we can start to guess, right? If you have a purple tongue and there's just stagnant blood that's not coming and circulating through that, then we can make a pretty educated guess that that's happening elsewhere in your body too. Really important. So there's the body color. The next one is the body shape. So the tongue itself will show you your fluid metabolism, meaning if you're retaining fluids, if you're dehydrated, that'll come up with the tongue. And one of the ways to see that is the tongue body shape. So if the body of the tongue is very small or very thin, that will tell you something about your hydration levels. Also, if it looks wet, right? If it looks wet or looks really dry, that's another one that's pretty obvious. We also have, where it gets, I think, more interesting is when it starts to get puffy. And the tongue oftentimes is retaining fluids. We see this a lot with complex chronic health conditions, a lot. I've got international clients that send me pictures of their tongues as part of like the service I provide is analysis of the tongue photos, right? And you can see that no matter where people live, no matter what kind of climate they're in, the common factor is when they have these complex chronic health conditions, again, like fibro, Lyme disease, mold exposure, this kind of stuff, chronic fatigue, oftentimes, not always, but oftentimes the tongue will be so swollen because their body is having such a hard time with fluid metabolism in general. We're holding on to water kind of everywhere, retaining fluids, things aren't moving as they should be, the tongue gets swollen. And one of the ways we can tell the tongue is swollen is with scallops. And what that means is the scallop marks, that's the teeth marks on the tongue. So if you stick your tongue out and you can see the impressions from your teeth on the edges, right? And on the front, on the tip, especially, that'd be a little concerning. What's happening there is your tongue is expanding. It's holding onto fluids and expanding, and it's swelling, and the teeth aren't moving because the teeth are, they're not going to move very much, right? So they're staying put, and the tongue is kind of molding itself around the teeth because it's so bogged down. This is really common, again, with like hidden pathogen conditions. Mold does this a lot. There's a lot of fluid sabotage that happens with these problems, right? So you'll see it in the tongue. So we've talked about the body, right? The meat of the tongue, and you look at the color of it and you look at the size and the shape of it. And if you have those scallops, then you've got some swelling in your tongue. So there's a reason why your body's retaining fluids like that. All valuable information, right? Now, the next thing we're going to look at is the topography of the tongue. What do you mean topography? Like a map, right? So the tongue traditionally is divided into different sections, and each section would correspond to a different organ or organ system in the body. So I'm going to just go into my computer here and we'll do a quick search, and I'll show you some of the images that I'm talking about because it's really fascinating once you start looking at this ancient map and then couple it with modern understanding of anatomy and physiology. Okay, so I'm at Google Images and I just typed in Chinese tongue map, and you can find a bunch of diagrams here. Basically, they all show the map where the heart is at the tip, then the lungs, the stomach and spleen are in the middle, and the large and small intestines are towards the back, kidneys and urinary bladder are in the back, and then we have the liver and gallbladder on the sides. And this may seem like a random arrangement, but really this follows the human body. It's just upside down. So the person's head would be here by the tip, and then our chest has our heart and our lungs, and then the midsection has stomach, spleen, liver, gallbladder, and then the lower abdomen has these other organs. So there is an arrangement that matches the anatomy of how we're actually built. And what gets really cool is that this is what we study in Chinese medicine school, right? As a way to start to look at somebody and like, here's another one, and start to diagnose what's going on with them, with their body areas based on what we see on the tongue. And this may sound like superstition or voodoo or something like that, but check this out. If I go to tongue lymphatic drainage, then look at this. Look at the Western medicine side. When we see images like this, where we can see the lymphatic drainage of the tongue, which is, this is not Eastern medicine, right? This is from like dental exam. This is just straight up Western medical stuff. You can see that there are different regions that drain to different lymph areas, just like in our other maps, right? They're mapped out the same way. Liver and gallbladder on the sides, heart and lungs here, spleen, stomach, pancreas, and then in the back we've got the intestines, kidney, bladder. And so what I find quite interesting with this is that as we have a backup with an organ causing sluggish lymphatic drainage, that can start to back up into the tongue, and we can actually start to notice those areas of the tongue having more issues. So if you were to look at your tongue and you see like a lot of redness right at the tip, but the rest of the tongue is not red, that may be a sign that there's some inflammation in the upper part of your chest. Okay, of course, I'm not your doctor, don't freak out, right? But you start looking at these things and you can start to put together the pieces of the puzzle. If the sides of your tongue are like very tender and raw looking, then it's most likely that your liver is having some problems, right? The liver is getting sluggish. It's very interesting when we start to put this together. So there's the body of the tongue. And then the next one that we should look at is the coating, the tongue coating. And what a lot of people don't think about, because it's not necessarily pleasant, is that we have a hollow tube going through the middle of our body. It's our digestive tract, okay? Starts with the mouth, goes all the way down to the anus. We are a hollow tube. And in fact, if you look at the human body, we're more of a donut shape, right? Like how donut has a hole in the middle. That's what we have for digestion. It's just that it curls and twists and winds around. But basically, we have just a hollow tube in our center, and that's where food goes through, right? That's our digestive tract. Now, what gets really interesting is that now science is finding we have a microbiome. We have all these beneficial organisms that are supposed to be working like synergistically together. There's a lot, right? It can go wrong. There can be all kinds of dysbiosis and pathogenic invasions and imbalances, right? That's a big problem. But we have these organisms, these especially bacteria, but there's also viruses, fungi, like all this stuff. It belongs there. It's an ecosystem, right? Even when it's in balance, but especially when it's out of balance. But even when it's in balance, there will be biofilms produced, which is basically like a protective slime that the bacteria and other little organisms use to live in, and they use it to protect themselves too. But they'll produce biofilms, and then we have our own mucus mixing in there. And so you'll have this whole tube from your mouth to your anus. Inside is all microbiome, and it's all coated with biofilms. And so what we get is a representation of that. Instead of looking up your butt, right, to see what's going on, it's so invasive. We can actually look in your mouth. You open up and say, ah, and we can see the slime on the tongue, and that will be indicative and reflective of what kinds of bacterial and other microorganisms are living in your digestive tract. Isn't that cool? You can see different types of tongue coatings. You can see tongue coats that are very thick. You can see tongue coats that are very thin. You can see tongue coats that are kind of white, right, or kind of clear. As it starts to get thicker, it might get more white. You can see tongue coats that are yellow, green, brown, black even. Okay, some of these things can be a little bit unsettling if you open your mouth and you go, holy smokes, look at this. All right, what is going on here? I've got a black tongue. Well, it might be because you just did a round of antibiotics or something like that. Okay, that can happen. Sometimes people get thrush, which is like candida in the mouth. And you can see that. It's a very strong tongue coat. It's huge. It's a massive thing. So when you look at this, you want to start to see this tongue coat. And a lot of times when people come into my world, not always, but a lot of times they come in with a pretty thick tongue coat. When people don't have much of a thick tongue coat, oftentimes, as long as they're not scraping it off, right? But if it's an honest picture, oftentimes what that means is they're going to have an easier time with the first two stages, like immune system and digestion. It's going to be pretty easy and smooth. They'll usually hit most of their progress comes in stage 3 when we go to neuroadrenal. But most people, okay, probably like 80% of people, like fibromyalgia, chronic fatigue, Lyme disease, mold, absolutely the mold folks get real thick biofilms. Like a lot of that is normal, okay, when you start going through a process to have a big, thick tongue coat. So don't freak out about that. You can scrape it off if you just want to reduce some of the biofilm load in your mouth and try to help that local area, right, that local oral microbiome. You can scrape it, but it's not really coming from your mouth. It's coming from deeper within the digestive tube. And it's reflective of what's going on with your whole body. So, you know, scraping it off is kind of just like trimming the little dandelions, like just trimming the flowers off, right? But there's still going to be roots in your garden, you know? So something to think about is what this is telling you and not to be grossed out by it, okay? Just take it as information and just try to learn from it, because what's really, really cool is when you start tracking this and looking at it, and you might even take pictures of your tongue over time, little tongue selfies, and you start to notice what you're doing and if that's changing things. A lot of the people I work with, we want to see those tongue coating going down over time as we're recultivating a different type of internal microbiome. That means that the pathogens are starting to come, like instead of being out of balance and dysbiotic and causing problems and inflammation, we're starting to get it to where the body is now handling that, and you're becoming a better cultivator of a healthy microbiome. And then you'll see that reflected on the tongue. Isn't that cool? Other things we look at with the tongue would be underneath the sublingual veins. So if you stick your tongue up, like touch the roof of your mouth, you can see these two big veins, right, that are underneath your tongue. And when you look at those, you're looking to see the size of them. You know, if they're very swollen, if they're very congested looking, if they're very, you can see the blood in there. Like if it's a very dark purple or dusky looking, that's oftentimes a sign, again, of low circulation. So this happens a lot, especially with women. Like men get this too, but especially with women if they have any kind of like history of menstrual issues, like painful periods, or they call it dysmenorrhea, or fibroids, endometriosis, cysts. Like you see a lot of that. You'll see the dusky, dark, and distended sublingual veins. So if you see those things, again, don't freak out, right? Never freak out. It's okay. We're going to just get information. But when you see those, you want to have a place to start and start tracking that, because as your body gets healthier and stronger and more efficient, you will see those things change, right? It's very, very cool to start taking some of this objective stuff. When people start feeling better, that's one thing. And then they start also looking better and being able to see that image, right? Hey, my tongue's not so greasy and slimy. Those tooth marks are going away, right? I'm not retaining so much fluids in my body. My tongue's not pale anymore. I feel like I'm getting better blood flow, and those veins underneath aren't so dark, right? Now the goal of this isn't to have the best looking tongue in the world. This is just an indicator. It's just an outward sign. What we're really going for is that internal vitality, right? And always, I'm going to keep coming back to this. If you've been in my world long enough, if you've seen any of my other videos, then you understand we have a step-by-step process, stage 1, 2, 3, 4, where you go body system by body system, right? Because looking at your tongue, you can see all this stuff, and then you get all this information, and you lay it out on the mental table, and you go, I'm overwhelmed, right? My fluid metabolism's off. My blood flow looks like it's not very good. I have some kind of coating here where there's pathogen exposure, right? I've got a problem there. There are other things we look at the tongue too, by the way. But I mean, you can start looking at that and go, okay, I've got a red tip. So does that mean I'm inflamed here? There's so much. How do you start to process this, right? Especially with these conditions, these mystery illnesses. You know, it can be really overwhelming. The best thing to do is to take all that information and start to organize it by body system, immune system, digestive system, neuroadrenal, blood circulation, okay, in that order. Moving through your body in that order removes a lot of risk of making mistakes. For example, you might look at your tongue and go, ooh, I've got these dark sublingual veins. So that means my blood circulation is not very good. Oh, what's good for blood circulation? Exercise. I should exercise. Yet, if it turns out that you've also got, a lot of thick coat, a lot of biofilm, a lot of pathogen load, you're already inflamed, doing exercise might actually make things worse in the long run, until we handle that inflammation first. A lot of people with fibromyalgia see this. We have post-exertion malaise, right? PEMS, post-exertion malaise syndrome, where when you push through an exercise, then all of a sudden the rest of the week, you're like dead on the couch, right? You suffer for it. And that's what's going on, is that pushing that blood around is actually pushing around more pathogens and more inflammation. And had we learned how to read the tongue, we could have known that and not gotten into that trouble, especially if we know how to organize our care in a logical whole system step-by-step approach. So if you are struggling with a complex chronic health condition, please know that you do not have to struggle alone. We've got an awesome international group. It's a chat group. We're off big tech. We got our own private chat group where I can say whatever I want without worrying about being censored, which is great. It's refreshing. Lovely people in there, very positive vibe. Everybody's very supportive, and they're all in different stages of their healing journey. So if you care to join this group, the link is in the description below this video. You can fill out an application, and when you get in there, as long as your application looks like you're a good fit, I'll do my best to get you in as quickly as I can. Okay, it's a small group. We tap out at like 100 or 200 people. So sometimes we can be full, and it might be a month or 2 months, but I'll try to get you in at the next monthly cohort as soon as I can. I try not to make people wait. But when you get in there, you'll be able to see other people going through this process, ask them anything you want, ask me anything you want. I'm happy to help, lend my perspective to your case specifically. That's why I keep the group small, so I can actually know who I'm talking to and answer their questions with, like a human touch. Okay, it's not generic. You'll also I have a vault in there full of interactive videos that help you figure out where you're at with your health. A lot like this one, right? But there's a lot more depth. Where you're at now, how you got there. We're going to look at all these causes and then what your logical next steps are in terms of creating a plan where you can be doing things that are practical. It's a wonderful place to be. It's free to apply. You can come on in and I'll see you in there. And I hope this video helps you. Let's get you feeling better. Cheers.